Welcome everybody to the Stoneridge quarterly installment of the speaker series. Today we have three plus myself, Tim Ashe, the Chief Clinical Officer of WellSky, Joe Lynch, my partner, Executive Vice President of Stoneridge Partners, and Brian Heck, Stoneridge Associate Partner and Senior Vice President here at Stoneridge as well. Today we're going to have a market update here at which we do quarterly in the speaker series. We also do and will be doing intermittent speaker series throughout our quarterly updates with ad hoc information. This particular webinar will focus on valuation trends, deal flow, PDGM, regulatory changes affecting home health, hospice, and behavioral health, and specifically today with Brian Heck, IDD business lines. First, let me welcome the guests and give everybody well wishes, and hopefully everybody's doing well in this crazy world that we find ourselves in interesting times. So currently we are we're still closing deals. It has been an interesting 8 months of 2020. Deal flow has ebbed and flowed as it normally does throughout a calendar year. Obviously, this one has been no different than any other one, although there has been some obviously higher ebbs and flows due to COVID and other outside circumstances of normal deal flow. Each sector that we focus on here at Stoneridge has had their ups and downs due to the COVID crisis and other issues, and we're going to talk more specifically about that as we get into our discussion. But we are doing transactions, and for the most part, valuations are actually hanging in there. For the most part, they are as strong as they were pre-COVID. There are some changes in the regulatory and reimbursement realm that took place pre-March of 2020 that are starting to take effect, that have changed some valuation in certain markets and certain sizes. Some of the buyers have changed because of that. So in certain verticals, some of the buyers have changed, which has created some different valuation challenges. But for the most part, things have stayed robust. So with that said, let's get into our panelists, and let's hear from them. So each one of them is going to introduce themselves, give a brief intro and some opening comments. Then we're going to turn this into a fireside chat, and then take questions from the people who have joined us today. So first, Tim Ashe from WellSky. Tim, why don't you take up 5 to 6 minutes, introduce yourself, and tell us what's going on in the market today. Tim, thank you for joining us.
Yeah, thanks a lot, Rich. Pleasure to be here, and I want to second my best wishes to everybody on the call today. It's a little bit dangerous if those of you that have heard me talk at national events or other places to give me an open forum and say, go ahead and do it in 5 or 6 minutes, but I'll do my best, Rich. I appreciate it. So just a quick snapshot of who I am. I'm actually a nurse practitioner by background, but have run large programs in the acute care setting, ran a home health hospice private duty, Meals on Wheels company for a number of years in upstate New York prior to joining Fazzi Associates as a partner. And eventually, as the president of that organization, we were acquired by WellSky approximately 2 years ago. And so I have the privilege of being the Chief Clinical Officer at WellSky, overseeing all things clinical related to our technology, analytics, and services. For those of you who don't know, WellSky is a technology, analytics, and service provider to post-acute and community settings, some additional assets in the acute care side of the world, but predominantly in the post-acute space. So I think it's fascinating. I think that when you think about the public health emergency that COVID represented and continues to represent, if you back up just a couple of months prior to that, we had PDGM come into play in the home health space. So the single largest payment methodology change in 20 years hit home health. And then quickly on the heels of that, as folks were just starting to get their feet underneath them, we have a public health emergency. And we'll talk more, I'm sure, during this call about COVID specifically. So related to sort of the fundamentals in home health and hospice specifically, which tends to be my predominant area of expertise, I think we continue to find organizations really challenged in dealing with PDGM on the home health side and predominant regulatory changes that are on the horizon. But I think fundamentally folks are still trying to figure out how to be successful in a value-based world. Lots of organizations are still structured, both from an organizational perspective as well as from a technology and workflow perspective, around volume. Even if they think they're pointed towards creating value or thinking about high quality outcomes at lowest possible cost points, they're still struggling with that. So I think predominantly what we see organizations asking questions around is, how do we become more focused on that triple aim, maybe even quadruple aim perspective? I think the workforce aspect of home health and hospice and other community service lines is only growing exponentially in importance. So if we think about just fundamentally the supply of individuals that are competent in creating and delivering care in the home health and hospice sector, that's challenged as we think about the demand and the growth of over 65 seniors, 36 million over the next really, 10 years, 20 years. We just see exponential growth on the demand side. But the real challenge for the providers are thinking innovatively about, how do I continue to grow and retain world-class competent staff? And oh, by the way, how do I think about that in the construct of changing my clinical model so that I'm using the data that I'm supposed to be using, because everybody tells me I've got to be into data analytics and predictive modeling. But how do I do that in an efficient and effective way, bring my staff along, continue to think about new referral sources, continue to think about creating partnerships and programs with payers, and again, in the current reality, struggle with the nuts and the bolts of caregiver safety, patient safety, PPE shortages, et cetera. So it's a fascinating time. With all of that said, incredible opportunities on the home-based care side of the world, as everybody on this call knows. And we see nothing but upside as folks really do start to, I think, become more focused. And in becoming more focused, they're simplifying their operating models, they're simplifying their clinical models. That includes home health and hospice, and for that matter, the personal care side of the world. They're thinking about different ways to use their core technologies, their EMRs. They are fundamentally adding data analytics and extending the clinical expertise that they already have in creating value. So that's a lot in hopefully 5 minutes, Rich, but that's sort of what we see happening. I think it's the perfect storm, but it's the perfect storm that is going to lead to a ton of performance success in the near term. And then I think some innovation in the into the short to mid-term.
Well, that's perfect, Tim. I appreciate it. Brian, you want to go next while Joe is still fighting? We're having some technical difficulties on him. But let's go with you, Brian. Why don't you tell us what you're doing these days and see what's going on?
Yep, sure. Thanks, Rich. So my specialty is really in behavioral health, and that's a pretty broad term, but specifically intellectual and developmental disabilities. Those services are where I spend most of my time. I do have some experience in home health, autism, mental health, kind of the other facets that sit within behavioral health as well. But IDD is really kind of been my passion and what I've been involved in most. Just my background, briefly, I've done about 80 transactions in the space between IDD and home care. Prior to joining Stoneridge, I was with a very large national provider of IDD services for about 10 years, left there as their VP of M&A. So I've done a few deals in the space and looked at 100 times more than I closed. So I think last check I looked at deals in about 46 states. So a few out there I haven't touched yet. Just to give you guys, I know there's a lot of home health folks on, so I'll give you just a really high level view of IDD services and what they look like. Really, it comes in kind of three different models. You've got Group home services, and this is going to be a residential setting where you've got anywhere from 3 to 6 folks living in a home that could look like a home in your neighborhood. A lot of folks don't know that they're there, have no idea. You might notice a ramp getting up to a porch or a large, 8-passenger, 15-passenger van in a driveway. Otherwise, it's hard to tell any different from a neighbor's home. So that's kind of the largest segment of the IDD world. They're staffed 24 hours, obviously. It's kind of CNA level type care. And then you've also got a couple other different models. You've got host homes, which look like adult foster care. So you might have an adult with developmental disability that lives with another family, and they take care of them. It looks a lot like a foster care model. And then you've got more periodic supports, which look a lot like home care. Somebody might only need 6 or 8 or 10 hours a week of some kind of minimal supports or some respite for their family members. So that's IDD services kind of at a very, very high level. You've got day supports that go along with that. You've got some other ancillary services as well. About 80% of the funding comes through Medicaid. You've got some additional state funds depending on the state. You've also got a few other, you've got Social Security disability as well that funds a portion of it. The industry in general, it's about a $70 billion industry that a lot of folks just don't know about. And the largest providers in that space, there's only a couple of them. They're about 1.5% of the market. So when you talk about a fragmented market, the IDD space is a perfect example of it, and really ripe for consolidation at this point. The market in general, you've got about 5 million individuals that are diagnosed with an intellectual or developmental disability. So again, it's a very large market, and when you start drilling down into those numbers, you realize that about 70% of them live with a parent or a caregiver, and so they're not receiving services yet. Well, as the baby boomers kind of age to the point where they can't take care of those folks anymore, it's going to lead to obviously a very large influx of folks that need services. And so when you look at the market in general, it's certainly going to expand over the next 20 or 30 years. We're starting to see technology can start playing a role in serving more folks as well. In terms of just kind of the market in general, demand has remained strong, both from strategic buyers and financial buyers as well. And I always make this comment, but it's not the sexiest business that we're in. I mean, it's a tough business, but it's going to be around for a long time. It's going to grow in the long term, and I think buyers are really realizing that. So demand has been strong, and I expect it to over the next 10 to 15 years.
Thanks, Brian.
Sure.
So moment of truth, Joe, did you get your audio problem fixed?
Can you hear me?
Yes. Good job, Joe.
Okay. Thank you.
Joe Lynch, my partner, and he's as technology challenged as I am, but good news is we got it going. So Joe, why don't you introduce yourself and tell me what's going on in your world these days?
Sure. Thank you, and I apologize for the delay in connecting. It was a bit of a challenge. So I am in my 30th year in the healthcare industry, primarily in the home care hospice realm. I'm in my 6th year with Stoneridge. I started in 1990 with a large hospital corporation called Orinda Healthcare. And it was about a $2.5 billion hospital corporation at the time. I was tasked with starting and acquiring home care agencies to be attached to their existing hospitals. After 7 years on the road and living in a few pretty desolate parts of the country, I got married and decided it was time to start my own company. So I started a company in 1997. It was private pay only for several years, and then I acquired a second private pay company, added in Medicare, and then finally bought another Medicare company. We ended up with 3 different divisions in Dallas and Houston. I worked with the great Don Cummins, our founder at Stoneridge, to get the company sold. I sold it to Humana, and then Don called and asked me to join the team. And I find myself sitting here with you today as a result. My primary focus is home care and hospice, but I do some behavioral health as well. I'm seeing a lot of activity still in the market, which is good for guys like us. We like to see activity. We like to be busy. There are a lot of challenges in the market, as all of you probably know, and we'll get into the specifics about that. But generally speaking, I still see a very strong market. I still see a lot of opportunity for both buyers and sellers right now. I'm very bullish on what's to come and excited about it.
Thanks, Joe. So let's tackle the elephant in the room first. And Tim, we'll start with you. Let's talk about COVID. So let's talk about the last 90 days or 100 days or however long it's been since April. And what's COVID done to the market? Where are we now that it's almost September? What's going on from a clinical perspective or M&A perspective? If you have an opinion, I know you do some due diligence work as well. What are you seeing? And how long is it going to last? If you can predict the future, we'll pay you for that, Tim.
I'll save that easy question that you just asked for last comment. We'll predict later. Yeah, I mean, I think that that certainly the term that I would use is uncertainty, right? So early innings, once the public health emergency really did emerge, I think fear ruled the roost, and so one of the positive aspects of that was that the industry came together fairly rapidly, and there was a lot of data sharing, a lot of science sharing. Not surprisingly, I think the home health and hospice industry has acted as a community in a number of ways over time, right? And I think this was a real positive early, especially as Washington State had one of the earliest hotspots, and we learned a lot from the Seattle area. I think rapidly volumes declined, specifically on the home health side, as the overall patient flow across the healthcare system stopped. Elective surgeries, slowed and then eventually halted in many of the metro areas. We saw commensurate admissions into home health really slow down. On our side, we can track it almost daily because we do a very large amount of outsourced coding. So we can see admissions turn off. And so if you use February as sort of a benchmark, we were off the mark by up to 30% in some regions of the country on admissions to the home health side. On hospice, we saw similar uncertainty and certain volume disruption, or certainly volume disruptions, but not as dramatic as we saw on the home health side, more in the 10 to 15% range. We've seen a turn back on volumes across the country, almost all regions, not to pre-COVID state for most of our providers and most of our purview, but certainly back to stability. We're still, again, in terms of February, we're still seeing about 13% admission decline off of that steady state run rate prior to COVID. So volume disruption, financial uncertainty. I saw a question come in about payroll protection funds, et cetera. Obviously, the CARES Act has been of assistance to a lot of Medicare providers, and then eventually to the Medicaid side of the world. That's been helpful. Cash flow obviously being king here. We saw a lot of interest in folks seeking help on the outsourced revenue cycle side, just to make sure that they were squeezing as much juice out of the claims that they had and the volume that they had moving through. I think the predominant, once you get through some of those financial aspects, which were incredibly disruptive, legislative and regulatory waivers obviously helped tremendously on both sides. Telehealth being one of those. Some of the intermittent providers, so nurse practitioners and PAs being able to sign orders, also were big aspects to making sure that access was not disrupted further than the overall flow of patients across the healthcare engine. But ultimately, I think, and I mentioned this in my opening comments, the workforce side has been critical. PPE and access to the right equipment to keep both professional and paraprofessional caregivers safe. Education, making sure that organizations were really dealing in science and not in fear, was a big part of that. And I think infection control early on was a very hot topic. So it's really, I think, impacted all aspects of organizational operations, from the financial P&L side to the caregiver and workforce competency side. Again, I see a very positive turn in volume. I think that unfortunately the uncertainty remains, right? Especially as some of the hotspots have maybe shifted across the country. We're still seeing disruption in that. So maybe that's a good place for me to stop and turn it over to Joe or Brian.
Brian, you want to tackle it next to see what's going on in the IDD space?
Yeah, a little bit different in the IDD world. I think we've really figured out that supports for folks with developmental disabilities are an essential service. And when you've got these 24-hour group homes, they don't have anywhere else to go, obviously. So we've seen pretty minimal disruption. The one place I will say it's changed a bit are with day programs. So a lot of these folks, part of why they're in a group home instead of an institution is you're really trying to give people their highest level of freedom that's possible. And so they're in these group homes. Well, part of that is let's get them, they need to be out in the community. We need to be doing some sort of community inclusion for the individuals we support. And so part of that would include a kind of a day habilitation center. Those have obviously been impacted just because of the numbers that you can't have more than 10 folks in a lot of places still. So those have been impacted, but really most states have stepped up and said, if your folks are unable to go to day services, let's do something with them in the community otherwise that we can do, whether it's a park or anything else that can be done. And most states have stepped up reimbursement for those services. So on the more center-based side, so if you look at autism services, for example, in centers, those have obviously been impacted with COVID. And from the folks that I talk to in that industry, they're still off a bit, probably more to the tune of 15-20% short on census right now. I had three transactions that were in the middle of diligence as COVID kind of came through, and luckily two of them have kind of sailed through, and those were the IDD ones. The third one is a ABA autism business, and we're still 10% off on census. But they're still getting done. As Rich opened with comments, transactions are still happening, maybe delayed, and in some cases maybe delayed, 3 to 6 months, but they're still moving along.
Okay, Joe, on the home health hospice side in your world?
What I've seen so far is a lot of cautious activity. I don't see things grinding to a halt. And I'm speaking not in terms of their daily operations. I'm speaking more in terms of what I'm seeing from a deal flow perspective. It's caused some people to be a bit more cautious about heading out into the market, but and certainly on the buyer's side, I am seeing some of the larger strategics that do seem to be acting a little bit more cautiously, and I understand that they've got thousands of employees and they have to take care of what's in front of them first. That totally makes sense to me. But in terms of the agencies that I'm interacting with, honestly, I'm dealing with a finite group of people, but I'm not seeing a tremendous setback. I've had a couple of clients step away to deal with issues internally, but I'd say that represents 5 to 7% of the people that I've talked to. Generally speaking, things are still progressing as they have in the past, and I haven't seen a large step back. A lot of people. I spoke with a lot of people on the front end of COVID, and it almost. I was worried about it, but I wasn't. I just kept thinking about the 80 or 90-year-old man or woman who needs care. And would they rather be in their home with one nurse or therapist taking care of them, or would they rather be in a hospital setting with hundreds of other patients and hundreds of doctors and nurses? And so for that, I really believe home care is a great place to be in this environment because it's so more easily controlled. But I'd say it's decreased things on my end by maybe 10% across the board, but generally speaking, I don't think it's had a tremendous effect so far. And I'm only speaking about the people that I speak with on a day in, day out basis. I'm not speaking for the industry as a whole.
Yeah, I think that's an important point, Rich. If I could just jump on the
Sure, yeah.
back end of Joe's comment, I couldn't agree more. I mean, I think being on the home-based care side of the equation is absolutely the right place to be right now. And I think from the patient perspective, it's the safest place to be. And that, that probably was true prior to, and it's certainly more true as we emerge on the backside of this. So I totally agree. We see a lot of activity, a lot of optimism, frankly, in the executive management teams that we're working with. It's just, there's uncertainty during the time when you see patient admissions slowing, and thinking about just a new world in which you've got to arm your workforce on specifics. So pretty interesting.
Okay. So let's switch the gear. I'm taking some of these questions out of order, guys, but technology. We were going to talk about that, but I think it's a good place. And let's go to all three of you again. We'll swing back to you first, Tim. How do you see technology? COVID has kind of sped up some of this telehealth conversation. There's been some increased reimbursement. The feds had added additional dollars to some of telehealth, some of the telemedicine. There's other technology stuff going on in our practices. So let's talk about technology and how you see what's happened over the last year, but also looking forward, what do you see technology doing in your space?
Yeah. Great. Thanks a lot, Rich. So let me start with remote patient monitoring and telehealth, and let me then spin back to sort of unified data and interoperability, because I think there's a story that plays out on both of those fronts. So more on the remote side, and fill in the blank with whatever technology you want to say, whether it's telehealth, remote monitoring. There's a slight difference as we see it, but obviously, I think folks have been using remote monitoring and making televisits for decades, and there's been certainly a set of challenges, most of them around reimbursement and the expense of those technologies, that's prevented wide scale and broad use of remote monitoring and telehealth. I think what we saw during what we are continuing to see over these months, and certainly has been magnified with COVID, is that there's a huge value proposition here. And so on the hospice side, we see a waiver where face-to-face can be done using telehealth. I think we're going to see, and hopefully we're going to see a proposed legislation in the near term for some expanded use around telehealth and remote monitoring. If you ask me 10 years ago, I would have said, you've got to be in this game. And so I think one of the challenges is there are lots of other industries that have been using telehealth more so than home health and hospice and private duty. But I think, if you think about care management and value, telehealth and remote monitoring allows you to gather data that would suggest when you should be putting boots on the ground, as opposed to historically, we just make visits based on some schedule. So telehealth and remote monitoring actually, not only does it allow us to capture data that better enables our clinicians, but it also helps us be more precise as we think about clinical interventions and when a professional or paraprofessional should be in the home. The other side of the technology equation right now is interoperability, and as the ONC has continued to clarify the rules around data sharing, data unification, data standards, we at WellSky view that as a huge and important step forward. As you think about even into the behavioral health IDD space, if we can have access to in a longitudinal view of the patient's experience in the healthcare system, interventions that have worked, demographics, all of the core data elements, that allows us to be more efficient in delivering care. It also allows us to be more precise with the specific intervention that's needed. So I think both sides of this have continued to I think grow in importance, but certainly that remote associated technology is critical and has proved very value add during the COVID experience.
Brian, Joe, anything to add on the telehealth side?
Well, I'd say from my vantage point as a previous operator in probably 2005 or 6, I thought that telehealth was going to take off. I was pretty convinced, like in the next year. And we actually made a pretty good investment in it, and it never paid out because some people did it, but by and large it wasn't widely accepted. I've seen so much more telehealth in the last several months that I'm going to tell you, I think it's here to stay at this point. I always thought it was, but the utilization of that service, I think, is going to go through the roof now. I think it has to.
Yeah, so a couple of things in my industry specifically. We've got one good thing that will come out of this is a lot of folks in the IDD system are dually diagnosed. So you might have some mental health issues as well. And there's very, very few psychiatrists and psychologists that really specialize in that niche. And so what you've been able to see is a kind of an evolution towards telehealth in that space specifically. So telepsychiatry, but you can get better services than for your individuals that you support because you can do a virtual visit with somebody that's got 30 years experience treating folks specific with IDD and mental health. So it's really going to, I think, provide some better services for those people. Long term, I think, within the IDD space also, when I talked earlier about kind of the least restrictive setting that you can be, you have folks that might just need a little bit of oversight. And so long term, there's a possibility of you might have a really highly trained caregiver that can keep an eye on 8 folks via cameras or sensors or whatever it is in the home. And you can do that at a cost, obviously, it's a lot lower than sending somebody into that home, 4, 6, or 8 hours a day or whatever it is. So long term, I think there is probably a play there from the technology perspective as well.
Awesome, thanks, Brian. Hey, Brian, let's stick with you. So let's dive into your space a little bit. Let's talk about who's buying, right? So tell me about the buyers in your space. Tell me what they're looking for. So financial versus strategic, and spend a little bit of time. You can talk about states they're looking for, and what makes a seller attractive to a financial buyer versus a strategic buyer. And then if you want, you can go into multiples, and I'll remind you of those things if you skip one.
Yeah, I was going to say, you're going to have to give me some cues here. There's a lot of things. So in terms of buyers, you've got financial and you've got strategic are the 2 main groups, obviously. The strategic buyers are still out there. These are folks that are 200 million and above, and there's probably about 20 or 30 of those. And they are, I won't say all actively acquiring, but they're all certainly looking at deals that make sense for them. And then now you've got kind of a new pool of financial buyers. And so I think that the financial buyers are starting to look at this space and realize that it's long term, the demographics are great. This is a service that's going to be needed for a very, very long time. It's one that will probably at least double in individuals supported over the next 10 to 15 years. And so financial buyers look at that, and that's obviously very attractive to them. In terms of states that they're looking at, it's interesting. There's kind of a top tier of states, and that's going to include places like Georgia, Ohio, Pennsylvania, North Carolina, Tennessee, Virginia, if I didn't say that already. And it's interesting. A lot of buyers are looking at states where MCOs have gone in and gotten started early. So that we could probably do a whole nother webinar on MCO and the IDD space and what that looks like now and what it's going to look like in 10 years. But that's kind of what's been a driving force in some of these states to get buyers in and trying to scoop up some assets there and establish a presence. And then you've probably got another 10 to 15 states that kind of would fall into what I would call tier 2. And there's probably, to be honest with you, a handful of states that most buyers just aren't touching right now. And I don't want to call anybody out by name on their state right now, but they probably know that they're in one of those states. So, and then I think you wanted to touch on multiples a bit too, Rich.
I know it's a loaded question, but we get the Q&A is going to have that multiple.
Yeah, so very loaded question. Anywhere from 3 to 10 times, which obviously doesn't give you a whole lot of insight. It depends on the state you're in. It depends on margin profiles. Depends on size, and if you've kind of reached that critical mass where you've got a second level of management, and it's not just the owners. Again, with this being such a fragmented business, 1 to 3 million in revenue is kind of a typical agency. And at that size, you don't obviously have the cash to invest in a management team. Once you get up over 5 million, that becomes more doable. Up over 10 million, and you're starting to develop what is a really attractive asset. And so that's when you start seeing the multiples go up. I would say just from a median perspective, Rich, probably 4 to 6 times would be kind of good guidance. And you start getting north of that when you're over $10 million, have good systems, have kind of a second level of management in place there already.
Great. Getting a couple of questions from our live Q&A feature. And I apologize if I mispronounced the name, but it looks like Raul. You're asking some questions about substance abuse clinics, and we do that here. I have 3 partners that actually specialize in that area. Our deal flow has picked up, right? So when COVID hit, we thought the industry kind of took a pause and wasn't sure how that would affect it. We've actually seen an uptick in that business. And we've also seen an uptick in we've seen an uptick in our business in those businesses, but the underlying businesses actually also seen an uptick as well. So the deal flow in substance abuse clinics as well as MAT clinics has been pretty robust. Now, a lot of that is obviously dictated upon how the business is delivered, right? So if COVID kept them from being delivered because of the way you touch the patient or delivered the services, those businesses actually took a pause for a while, and they're starting to come back. But if they could figure out a way to deliver their services, the actual demand for the service has been up. So, and the valuations have not faltered at all. So we are in the process. We have a couple closings in September at very good valuations. The deal flow has slowed not the deal flow, but the deal process has slowed because of travel restrictions, things that we talked about in the last speaker series 90 days ago. That stuff is still starting to fall off, but it's, that quicksand that we discussed about traveling and getting out to see people, it's getting better, but that piece of doing deal stuff is tough. But I just didn't want to ignore that question in case you dropped off. But and if you want to reach out to me, I can get you in contact with one of our partners on the substance abuse and MAT clinics and other drug addiction clinics that we do handle. So thank you for your questions. And I apologize if you thought we had one of our partners on this. We will on other ones, but thank you for your questions on that. Brian, thanks for that more detailed stuff on your business in IDD. Tim, what about, let's talk about fragmentation and the consolidation, and along with that, we talked about volume to value versus fragmentation. Kind of lump all that together, and let's talk about what are you going to see happening? Because in my mind, I've been in the home care business since the late 90s. And people have been talking a fragmented market. They've been talking about consolidation, but we still have 13,000 home health agencies. That number never seems to go away. And it is a very fragmented market, but we went through a time period where you had national companies getting companies all across the country. What is that looking? What's the national trend about size versus fragmentation versus how do you provide value? What are your comments on that, Tim?
Yeah, thanks. There's a
lot to that question, but
a lot to that question. So, from a fragmentation perspective, I couldn't agree more. I came into home health just after PPS. So I think it was 2002 when I officially started. And, we saw obviously between IPS and PPS around 2000, we saw almost a 30% reduction in the number of providers. So 13 to 9, and now we've grown back to 13. So there's a cyclic wave of just pure provider number. I think what we're starting to see though is with the, I would say, increased presence and probably the shift to manage care in general starting to accelerate, networks being really critical. So there's some pressures, there's some outside pressures, or maybe some sub-outside pressures from health systems and from payers that are, I think, adding to the forces of consolidation. So, PDGM didn't help the small player that maybe didn't have the access to capital for training, as an example. Same thing with COVID. So for folks that may have been running thin margins, there's additional uncertainty around their financial go forward. So I think that helps the overall M&A picture. You guys are specialists and experts in, that's not me. But from a fragmentation, there has to be consolidation, especially as we think about payers wanting to create narrow networks of best-in-class providers, which leads me to the second part of your question, which was around value. So if you want to be in that equation going forward as a provider, I think you have to figure out how to move from pure volume, even in PPS environment, just making visits, obviously with mind towards the budget around a Medicare episode. However, it's got to be more than that. And so the shift in the requirement and the core competency of home health providers specifically needing to think about the needs of the patient, predicting what the best possible outcomes are for a given set of interventions is a requirement. And then being able to demonstrate that back to payers and back to health systems to have access to those networks. Again, whether it's preferred provider situations with a health system, or whether it's formal contracting, and oh, by the way, risk enters into that equation, right? But risk contracting and performance-based contracting with payers is going to be the norm, and it's already starting to be the norm in many areas of the country. So I'm not sure if I answered it cleanly, but there's a lot there, and
there was
some thoughts.
Any comments, Joe and Brian, on that value-based versus?
Yeah, I do. There's one thing I will say that I find to be a little bit refreshing is that it seems like a year ago we were either selling our clients' companies to a big company or a bigger company. And nowadays, with in the current climate, I'm seeing a lot more mid-range buyers, meaning not billion-dollar companies buying $5 million companies, but $20 million companies buying $5 million companies. And I think that's kind of exciting, because if you've got $1 billion, $1 million, nothing in between, then that is talk about consolidation. I mean, you're heading in one direction. I kind of like the idea that we've got more mid-level buyers stepping up. Now they're using some more bank debt, and that's making things sometimes a little bit more complicated in the sales process, as opposed to just writing a check out of the company's checking account. But I am seeing a difference with a lot more mid-level buyers, and I think that's exciting, because it's I think it creates a different layer in the future for the future.
Yeah, I would agree, Joe. We're not quite in the IDD space, at least. We're not quite to the 20 million guys buying 5 million guys, but there's certainly now a new handful, 5, 10 groups that are $100 million. But some of them have been PE-backed roll-ups that are now buying the 5s and the 10s too. So it's not just the 3 or 4 largest, national providers that are buying anymore. So I would agree. It provides some competition with the big guys, and the $100 million guys have had a lot of success in getting deals done here recently. So.
Okay, Joe, let's go into your area, and kind of the same question that I gave to Brian. Let's talk about multiples a little bit. Is it a good time, bad time? What are the buyers looking for today versus what they were looking for maybe in the past? And is it a good time to sell with all the chaos going on in the world?
As I mentioned a little while ago, there is, I believe it is a good time. and there are a lot of buyers out there. The buyers have shifted a bit. From what I've seen, it's less monster companies buying and a lot more of not a lot more layering going on. To answer your question about what they're buying for, what the multiples are, that really depends on the company, and that answer, if you'd asked me that a year ago, would be the same. A $20 million company with a 20% bottom line is going to sell at an absolute premium. A $5 million company with a 10% bottom line is going to sell at a lower multiple. I think to get more specific, in the $3 to $10 million range, let's call it, you're probably looking at in this market, a 4 to 5, but edging closer to 4. But again, depends on the company. And it also depends on the buyer. I mean, I hate to sound generic, but there's so many facets to this. And if a buyer really needs to be in a certain area, they might pay a little bit more for it. Just generally speaking, with the buyers that I've seen in the last, say, 6 months, I am seeing multiples. I used to say the only quality home care or hospice company that sold, I'll keep it to home care for the moment, or home health, that sold below a 4 multiple were troubled assets. If they don't have good books, if they've got some sort of a clinical review going on, if something's happening there, then they might be beneath the 4 multiple. 4 to 5 was sort of the normal range for a healthy company. And, quite regularly we were getting 5 for $3 to $5 million companies. I'm seeing that down a little bit. I still would say that it's between 4 and 5, but I've seen a little bit more buyers getting a little bit more traction in the closer to 4 range. But again, it just depends on the asset. If you're talking about a quality company with solid net income percentages or EBITDA percentages, then and depending on where they are, then that they can still sell at closer to 5. But again, if you go back to size, if they get 10 million and north of that, that's just, we don't see those as much anymore in the market. It's not to say there aren't a bunch of them out there. Those should expect a premium multiple, I'd say.
Okay, thanks, Joe. A couple other questions that have come in. One was with, I just don't want to ignore any of these. One was with a medical practice. We don't go after these a whole lot, so we don't see a lot of medical practices. The issue with these really depends on size, and we do sell some. So I'd be happy, and I do have one partner that does do most of my medical practices. So I don't know if I feel, and Tim, I don't know if do you all do much medical practice work? Yeah, they're tough. I'll be honest with you, because a lot of the medical practices at a certain size, they're really, it's the practice, the smaller ones are really salaries for the docs. The value of the practice is not as high as you think, because they're taking it all out of salaries and you have to replace them. It's really a balancing act between what you're paying the docs as a salary and versus what the practice is worth. Now your specialty practices where you're selling a lot of other ancillary services, products, or other services along with the practice of medicine, that could have a lot more value. Or if you had a very large specialty practice, and there are some buyers out there, and we do some of that work as well, but it's just not something that, to be honest with you, I have advisors that are that interested or have that background into that we chase a whole lot of that work. Like I said, I have one advisor, and I've done some of it myself. I'll be happy to discuss it offline, but I don't pretend to be an expert to tell the whole group what I think. So unless Tim or Brian or Joe, you all have any, the question was valuations of medical practices. And then the last question before I give it back to the guys to have any closing comments, this is the one that Joe and I were actually talking about, and I don't want to ignore it. I don't think there's a good answer to this question. It was a very, very well typed out question. I'll read it. It's from Anthony. Many sellers and buyers have received PPP loans and have intended to seek forgiveness on such loans. I am curious how buyers and sellers are dealing with these loans, since many of these loans have default for change of ownership control. The short answer is there's not a lot of guidance here. There's just not a lot of guidance. We are still doing transactions, and all of the transactions we've done in the last several months, our sellers have these loans. And I can't tell you any one of them have done it in any repeatable format versus the next couple of deals that we've done over the last 90 days. It is something where the buyers and sellers have come together to decide how to treat this along with their banks. Some have gotten the forgiveness that they wanted. Some have escrowed it. There's just a multitude of ways. So there's just not a lot of guidance out on this one yet. And I don't want to say it's holding up transactions, because it's really not, but it is for discussion between the buyers and sellers. Joe, do you want to add anything? I know you've been dealing with this as well, or Tim or Brian. This is just something that there's a lot of direction one way or the other out there.
You know, one thing that I try to live by the old saying, know what you don't know. And this is all new, and I'm not going to sit here and spout what you should or shouldn't do. I would just recommend to, and I have recommended to my clients, speak with your accountants, speak with your bankers. They're the ones that have been up to their necks in this stuff since it all started. They're the closest thing to experts that are out there. So I'm just uncomfortable telling folks what to do. We are dealing with it, and it does seem to be, things do seem to be moving along on all the transactions I'm working on. But I would just make sure that you have in-depth conversations with in order, I'd probably say your banker first and your accountant second, because the bankers have been studying this stuff, and they know a whole lot more than I do.
Guys, we have about 5 minutes left at max. Any closing comments or anything you all wish to opine?
There's one thing that I would like to say real quick, and I want to be crystal clear. This is not a political statement. I don't care who you vote for in November. But the Biden tax plan, we have received it, and it is proposing the capital gains move from 20% to 40%. If you're really thinking you want to sell pretty quickly, but you thought maybe you'd put it off to the beginning of the year, I don't know who's going to win. I'm not saying I do, but that is something to consider. It's an extra 20% in taxes is something to consider if you're sitting on go for a sale. That's just a comment. Again, don't care who you vote for, but that's a business statement, not a political one. That really could have a bearing, and most of the people that I've spoken with were not aware of that. And I have had a few people say, well, in that case, I'm going to get going on it. It usually takes a few months to close a transaction, so it's going to be tight at this point, but I just thought that was worth mentioning, Rich.
Yep, no, it is. Yep. Brian, Tim, anything we skipped over that you wanted to?
I'm good.
I think it's a great conversation. I appreciate it, Rich and Joe and Brian. My last thought is probably where I started. Tons of optimism for home health and for hospice. I think it is the right place to be, given all the factors we talked about. Yeah, lots of pressure points that we're currently in, but most of the trends and certainly the projections look very positive for this space. So appreciate you having me, guys. Thanks for the invite.
Well, thank you, guys, and we'll be sending out our next quarterly one here soon. And everybody stay safe and healthy, and talk to you all soon. Take care. Bye-bye.